When I got my diagnosis, I talked to my general surgeon, and right away we started moving ahead as far as what were my options. Then I immediately went to talk to my plastic surgeon, who I had developed a relationship with him from prior procedures.
Breast reconstruction is very important for patients. For me, it's integral as part of their cancer journey.
My anticipation with the surgery was that after the mastectomy was done, I knew that there is expanders out there.
Traditionally, we always use saline expanders, and they've been around for decades, since the 70s and 80s. They carried higher risk of infection. You had to actually have the patient come into the office, be seen, get injected, come back, have pain for 2 or 3 days, come back again, and it was just a recurrent process. The AeroForm expander, to me, is a new game changer.
I'm the surgical business manager at a hospital in South Florida. My job consists of everything that has to do with the business end of the surgical suites. When I found out about AeroForm, it was through a products review committee meeting that one of our sister hospitals. The product was approved, and it was unanimous among all of the business managers of every entity at the system. When I found out the way it works, that is no needles, that I can do it from my house or from anywhere, I thought this was way long overdue.
The one biggest benefit is that they can control their expansion at home, slowly. They don't necessarily need to come to the office. They can just send us a phone log and say, I've done it, successful. They are more comfortable. They're less inconvenient. They can go back to work. They don't have to take on an appointment to come see your doctors.
I was determined that I was going back to work in 2 weeks, and AeroForm make it easier because it would be less time for me to take off from work. When Dr. Flores did the first expansion, I said, is this it? Because it was like nothing was happening. Later on, I felt a little bit more pressure, and I started seeing the difference a couple of days later. Normally when I dose, I do it in my bathroom. Not because of anything, it's just that that's where I sort of station it. So it's one of the first few things I do in the morning, and the last place where I am at night.
With the AeroForm expanders, we're able to actually expand them at a much faster rate than we were with the saline.
Since my last post-op visit with Dr. Flores for the expansion, I have only seen him once. Now, 6 weeks later, I'm going back to see Dr. Flores for a follow-up. I have been able to maintain my working hours as I normally did before, and coming home, taking care of my mother, taking care of my house, routines, and everything that my daily life entails.
She's super happy, and she knows products. She's a product review person for the hospital. So she is now a big advocate. She wants to tell everybody. So I think it worked out for her.
After my permanent implants are in, it will be a close and a chapter of this process that I have gone through.